Welcome to the county seat. My goodness, it's been an unprecedented couple of weeks, and we hope you and your families are safe and well. The COVID-19 story has been top of mind worldwide, and we here at the county seat wanted to give some insight into how local health departments prepare for a pandemic, the powers available to the county, what counties are doing, and lastly, looking on the ground at the impacts. So first, let's start with a conversation about local health departments.
Typically, health departments are involved in clinical services like immunizations, tracking communicable diseases, and performing restaurant inspections to protect the public. Utah has 13 local health departments that work together with the Utah Department of Health and local governments to keep the public safe. But what about emergency response to a pandemic? Dave Heaton, the Public Information Officer for the Southwest Public Health Department, met with me to explain how local health departments protect communities during an emergency.
Local public health has been involved in emergency preparedness and response ever since the anthrax attacks following 9/11 years ago. It was decided on a federal level that funding could be given to public health on the local level to be able to respond to bioterrorism or a pandemic or any type of large-scale emergency that affected the health of the public. But we want to prepare for the worst and hope for the best, so to speak. And so at least annually, sometimes several times a year, we will prepare tabletop exercises, drills, things where we work with our county emergency managers and all of our local emergency response partners, whether that's our local hospitals, EMS, law enforcement, fire department, education system, elected leaders. And so for years, we've had pretty close relationships with those groups. We're familiar with each other. We've worked together in these drills and exercises so that when something comes up, like this pandemic, we've already worked together. What we have prepared for and what we're preparing for is, one is what we call a hospital surge. And so we work closely with our hospitals with the coalition to where if their resources or beds become taxed or limited, we help them put plans in place and get the word out of alternate care sites. We have a model called a Community Information Center, where if a person comes to a hospital or a clinic and they've got symptoms but don't need hospitalization or able to go home and take care of themselves, they would go to one of these alternate sites, get information, perhaps PPE or personal protective equipment like masks or hand sanitizer, Kleenex, those type of things if they're available, and be able to go home and care for themselves or be connected with people that are going to look after them.
Businesses in the community are also stepping up, should there be a need for additional beds.
That is a possibility. We have had local hotel chains offer their facilities if we need alternate care sites for quarantine, isolation, or even hospital-type care sites.
Keeping tabs on the COVID-19 pandemic can be overwhelming, and finding reliable information is important to keeping on the same page with state and local governments as this situation unfolds. You can keep track by following coronavirus.utah.gov for updates here in Utah. For the county seat, I'm Derek Dowsett.
Thank you for that report, Derek. We will also share links to the other 12 health departments around the state on our social media channels. When we come back, we will talk to a Juab County Commissioner about how an emergency declaration works and what it means to the community. You're watching the county seat. Welcome back to the county seat, traveling around the state, trying to figure out exactly how the coronavirus is having an impact on our lives. County government is a big part of it. Joining us for this conversation right here is Clint Painter, who is a commissioner in Juab County. Clint, thank you so much for taking the time to join us.
You're welcome, Matt.
And we'll stay our social distancing apart. Your county is one of the counties that's declared a state of emergency. Why do you go through that process?
So one of the reasons that they make the declaration is to, number one, make the crisis official. They make it so they can activate their emergency plan, and then they also make it makes it so you can request aid from other political subdivisions, either the state, federal government, or maybe even other counties that may have other resources that you don't have.
Are there resources being depleted that people on an average, daily basis don't see happening, that are going on behind the scenes? Because life out there on Main Street, although it's kind of kicked back and the schools are closed, it seems fairly normal out there.
Well, right now, the resources we're seeing mostly depleted are with our EMS department. As we know, the N95 masks are in short supply. So when we have very few of those as well right now, and you can't get more, unless you're on a long wait. So some of the emergency things like that, we are seeing a depletion in, and most of it falls along those lines. We're just making certain that with the activation and the aid and the resources that we're asking for, it's just we're more or less just being prepared for when the time comes. Mm-hmm. We don't want to ever be stuck behind the 8 ball, so to speak, so that if we hit a disaster and we get all of a sudden 12 people that wind up with the COVID-19 virus here in Juab County, that we run out of resources and can't help them, because we always want to make certain that all of our residents are taken care of.
Your medical and hospital facilities are somewhat limited. Is 12 a number that would actually throw them over the top?
I think 12 would probably would max them out. We had a meeting just a little over a week ago with all of our partners inside the county that are affected by this, and the hospital is one of them that came, and they represent themselves very well, and they have plans put together. They can handle. They have respirators. I think the number they gave me was 6 respirators right now, and so 6, of course, is the ideal number. So 12 would be a problem for them, assuming they couldn't get more from other counties within the state right now.
So is there a chain of command in emergency declaration? I noticed the governor of the state also made that declaration, and the President of the United States has made similar enactments so that he can use special powers.
A county can declare a state of emergency without the state declaring it or without the federal government declaring it. They can declare it first if it's in their area. It's always more beneficial if the state or the federal government declares it first, just so that you're kind of following along those chains, as you said, the chain of command, just to make certain that you're well within your boundaries. But as a county can, of course, apply for, just to make the declaration first. They go through their county clerk. They make the declaration to the county clerk in an open meeting, and then their clerk actually will declare it to the state for you.
Has that been part of your emergency planning? Most people think earthquakes and things like that, which we've also had, but they don't. That doesn't necessarily come up as a for the normal person. But is that something a county would be doing?
Our county emergency plan actually does take into effect a whole bunch of different scenarios. One of them is, health, and I know that they've partnered with our health department to make certain that they have situations prepared, or everything prepared for these type of situations. They have in the plan, if say there was a truck that the freeway runs right by Nephi. If there was a truck that was carrying a hazardous material, were to wreck right there by the high school, they have plans in place, to evacuate the high school in that area so that material or the gases or fumes from that hazardous material won't affect the school. So they try to cover every possible scenario they can think of. So yeah, you're right. This is one of those that they do think of.
So one of the other things that have been curious to me in the process of analyzing this and watching things happen around the state, most of us that are on the Wasatch Front, one county has a health department. So Davis County Health, Salt Lake County Health, Utah County Health. When we get into the rural counties, you share that health department task between multiple counties. Does that have an impact on your emergency planning situations?
It does have a little bit of an impact. Ours is part of the Central Utah Health, and we have 6 counties in ours, and each county does have an office located within their county. So ours is actually here in our county building. It's just upstairs. So we do have an office, satellite office here.
So do the other counties that participate in this 6-county unit, have you guys got each other's back?
I think we do. I feel like we do. Even though we're 6 different counties, we meet together as one health department or health board, and I feel like we're one cohesive unit. So we don't have the population that Salt Lake County or Utah County does, but I think together we work together like one unit, and so I think we do.
Are there any things that the public is not seeing that you guys are engaged in that you think they should see or know about?
I think right now, our county commissioners, our sheriff, other departments within the county are constantly on calls with our congressional offices, with the governor's office, lieutenant governor's office, the health departments. We're always moving through things, trying to make certain that, are we covered, are we good? If there's a new question that arises or a new situation, we're trying to make certain that we have answers for those type of things. So I just want our people to know, our residents of Juab County to know, you're safe, you're good, we're in a good situation. And if something were to happen here, I think we're gonna be all right.
If they have questions on help that's going to be coming down the line, not only health issues, but economic issues, how do people within rural counties or within your county reach out to you?
So within our county, our economic development director just yesterday started making a little bit of a email blast. Well, it was actually a text blast to a lot of our business owners. And then he made some posts on Facebook or other social media saying, hey, I'm here if you need me. Here's my email address. Please contact me if you're having problems or issues right now. Please let me know your story. I'll help you. I'll do what I need to do. There's aid available. Let me direct you.
Okay, that's great. Clint, thank you for taking time to help us understand the county side. We're going to take a break on the county seat. When we come back, we're going to look at how businesses, not just governmental agencies, are improvising and navigating their way through this. Stay with us. We'll be right back with the county seat. Welcome back to the county seat. We are in Juab County in the Nephi talking to Commissioner Clint Painter about what's happening in this community. We've looked at the health angle, but there's an impact, there's another side of this whole thing. President Trump a short while ago made reference to it. He said, when is the cure worse than the disease? Indicating that there is an economic side to this pandemic and how people are taking place. How is the business community coping here in your county?
I've been trying to reach out to a lot of our different businesses in town, in the community, just to see how things are going. I've sent them text messages or called them, and we have some that are struggling. They've been telling me, we've got some businesses that said they're 20% down, others are more, and others are said that we're doing all right. So it's a little bit of everything still. I talked to one of our local businesses, and they were offering potatoes inside of a hardware store, because they knew that was a need that other people weren't getting, and so they said, well, let's sell these potatoes to help people out. And so we have a lot of businesses that are looking at different ways to reach out to customers. We have a local photographer that, instead of being able to get out and do photo shoots at dance recitals or at soccer games, she's reaching out and telling people, hey, now's a great time to organize those photos. Bring in those photo books, let's digitize them for them. Bring in those VHS tapes, we'll get those digitized for you. It's taking a lot of different unique approaches. We do have some businesses that are being pretty aggressive with coupons, trying to get people in to see them.
So should people in the community who are doing the right thing, they're staying home, they're self-isolating, they're staying their distance, they're trying not to get out too much, should they not be afraid to engage in the local, to order food from a restaurant or, get supplies they need at the grocery store? Do you feel within your, that is a safe activity for people within the community?
The restaurants are pretty heavily regulated. They've gotten procedures of what they need to do, how often they need to wipe counters down, wash hands, things like that. So they're following those guidelines. I think that they're safe places to go to. Keep your social distance, call in, make an order. A lot of the businesses that are normally sit-down restaurants are offering curbside pickup. Some of them are offering free delivery, or just delivery if they're not even a regularly delivery place. They're just offering that delivery to try and reach out to different customers, or to keep their business, to keep their employees going. And so I don't think people should be afraid of it. I think instead of just planning on going and sitting down and spending an hour inside of a restaurant, plan on calling in, going, picking up, taking it home, and enjoying around the dinner table with your family instead.
How do they find out about what businesses have altered business and what services are still available? Is there a place to do that?
So a lot of the businesses have been reaching out on social media. just this last weekend, I had gone ahead and I reached out or tried to reach out to all of the businesses, or at least check their Facebook or their websites, and I put a list together of all the businesses that I had noticed that were still open, and tried to circulate that, and that's gotten some really good views and shares on on social media. And so I think you check your social media. A lot of people are trying to post there to get the word out. But I think a lot of it, even just driving down Main Street, I mean, you don't have to stay in the house all the time, but trying to stay a little bit isolated from other people. So if you're in your car, drive down Main Street yourself a little bit and look and see what businesses are open.
If people are out and traveling and are healthy, I want to preface that, healthy, and they're coming through your community, are you encouraging them to reach out in those safe protocols and those safe practices to try and give a little support to the local businesses as they pass through?
Oh, by all means. If they're driving through, like you said, if they're healthy, please stop in, get you a drink or a sandwich someplace locally. Just follow the social distancing protocols and please stop in. Yeah, absolutely.
All right, well, let's take a look at some things that are happening in other parts of the state that involve businesses and see what they're doing to cope.
There's been some adjustments on our side when it comes to the way we have to protect our employees when we do these estimates. We've also had a large number of jobs that has slowed down on the flooring side and the construction side. A lot of people have not shut the jobs down and going to wait this out.
We do a lot of sanitizing and a lot of, especially with the touch points in the hotel room. Our hotel feels more like a hospital than a hotel. Every time you walk around a corner, you can sanitize your hands. We've tripled cleaning efforts. We've got a great plan to protect our employees as far as how they interact with guests and social distancing. So absolutely, travelers are safe coming here, especially right now. If you're looking for some social distancing, there's not a lot of people right here. But if you want to support a place, just to give people in our industry hope, maybe just get online and book a future reservation, even if you don't feel comfortable traveling right now. I know we're trying everything we can to get people to travel as soon as possible, but even if you're booking a reservation for September, October, November, that still gives people a little bit of hope.
What I do relies on people being able to be together, come together in large groups. I mean, whether it's for entertainment or for a corporate event or something like that. So yeah, I just saw it dry up really quick. Where I had a friend who owned an event production company. Obviously, that's his entire business too, is just getting people together. So we bought a bunch of live streaming equipment in order to live stream events. We can live stream concerts, all that kind of stuff. One of my clients, I worked for a concert venue in Park City quite a bit, was really excited about live streaming because, he can still put on a concert. All the local artists all of their events have canceled, and to give them something that, somewhere to go and play and still have an audience, and the people are really excited about that.
Probably 3 weeks, maybe even a month ago, of just starting to hear people make sanitizer, to help, and it really, caught my attention, and the decision we made is, hey, let's go ahead and stop making rye whiskey. Let's switch over to bourbon. Corn is a pretty inexpensive grain, and so if we're making hand sanitizer, it's not the worst thing. So we can run some bourbon batches a few days. We can run some hand sanitizer a few days with that. And the hand sanitizer, we'll probably throw some sugar in there. Sugar hasn't been easy to get at all. That's another, commodity that's being limited. We're getting organizations reaching out to us every day for sanitizer saying, hey, we want to get it in people's hands. I just think that any way that people that have the means that can help other people is what we're meant to do.
Our life's changing, and maybe this will change us forever, as in working from home or lack of contact with people. So it'll be interesting to see how this plays out at the end. I hope it's over shortly. I know some people are struggling really, really hard with the fact that they can't go to work.
So as you can see, people around the state are finding ways to navigate it and look at the opportunities and look at the responsibilities they have to take to navigate this pandemic. Any last words from Juab County, from your perspective about business?
Yeah, one of the things that I found that's really been very helpful is we've come together as a community even more. And I've seen businesses that are helping businesses. We have one of the larger businesses that's remained open. They're reaching out to some of these restaurants and having them cater in a meal every day. Or weekly, I guess is what it is. And so, it's nice that they're reaching out and they're seeing that there's opportunities that they can help somebody else. And it's just one more way that all of our residents and citizens can come together to help each other out in these situations.
Excellent. Clint, thank you so much for taking the time. We'll continue our conversation, looking around the state, finding out what's happening, and having an idea of how calm people should be able to still be and what parts of life are still normal as we navigate the COVID-19 pandemic. We'll be right back on the County Seat. Welcome back to the County Seat. It's worth taking a moment to take stock of where we are. We had no idea what our lives would be like 30 days ago, but we should be grateful for having the time that we now have with the people who are really important to us. We used to be 60 years ago family units, and we would venture out into the world. We weren't linked by internet conferences, easy travel, mass transit, all the things that make life convenient, but also separates and isolates us. When you're on lockdown with your family, it's a great time to take a bike with your kids. In fact, I saw a father and son out riding this morning, going around and around in circles on our lane where I live, that would never have taken the time on a Monday or a Tuesday or a Friday to do that sort of stuff. It gives us a chance to slow down and be grateful for the things that we have, especially our families and those close to us. We'll get through it all, and we'll bring you more updates on how to move forward next week on the County Seat. Thank you for watching the County Seat. Be sure to subscribe and turn on your notifications to keep up to date on the program and happenings around Utah.